Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, pigmentation, and facial balancing. I'm going to mostly just have this as an open forum tonight. I may end the show a little bit early too as well. We'll take a look and see. I had a lot of questions yesterday that I wanted to get to though, so I'll try to touch base on some of those tonight. But I have an early Phenol peel tomorrow, so I may not be on for, definitely not be longer than 30 minutes tonight. So I'll kind of wait for a few more people to join us and answer some of the questions that I had yesterday. Some of the people that were on were asking particularly about, well, there's a lot of questions. One was about microneedling for rolling scars, whether that's effective. Whether microneedling is effective for ice pick scars is another question. So I'll walk you through just kind of what my thoughts are for microneedling, because I think that there are a lot of people that go down the microneedling route because they're told that that's essentially how you could work on your scars. That's something that's going to improve your scars. And it's really for just very few types of scars, I would say. Really mild superficial scars, maybe a little bit of texture, it could help for that, but it doesn't help enough really for the vast majority of patients. And almost everybody this week had tried microneedling. One of my patients today had did 8 sessions of microneedling before. Another one actually had did 6 sessions, and they get sold on this package of microneedling sessions, and they had very thick, deep scars, and it didn't improve their skin. So, I think it's worth looking at this, because a lot of times, these are things that you're told would be necessary for your face, and you're kind of you're trusting people that this is the best way I could do it, and we'll sell you a package. It has to be 6 or so, and it's really arbitrary numbers of why does it come to 6 microneedling sessions? Why not 10? Why not 12? Why not 3? Why not 4? And it's really unclear why it's always 6. And it just turns out that's just the way that they were told to do it from their device manufacturer, really. And it's too bad, because it's there's a lot more involved to scars than just some package. And none of this stuff should be done with a package, really, when it comes to scars. There's some people, actually Biochemie just came out right now, and it's when we do these, it may end up being that I saw her recently, and I was just it may end up being just a little bit of TCA Cross, but we don't have to do the laser over and over again, things like that. And so it's some people will then tell you, well, you could do Subcision, you do 3 things with the Subcision, and here's a package of three or so. Hi, Biochemie, how's it going? I have to give you a shout out there. Do you have any treatments for the body? Yeah, what kind of scars or what kind of treatments are you looking for the body? I do a lot also, by the way, of Cellulite. Cellulite, actually, I'm going to talk to you a little bit about that, because it's interesting that a lot of people don't let me share the Cellulite results, and also it's on social media purposes, it doesn't. They always flag my account whenever I showcase it, but it's actually really rewarding to break up Cellulite. Actually, you could break it up just like you can for scars in many ways. There's a component really that is tethered down and pulled down, and going at each individual bond and breaking it up is super effective actually for Cellulite. So interestingly enough, Cellulite's actually something that I could treat really well, and it's something that works really it's super satisfying for patients. I've actually had patients that I worked on 7-8 years ago who I still see today, and it still looks amazing, and it's it still holds up really well. It's none of the stuff that kind of the gimmicky stuff that people were doing with these injections, or there was these, at one point, I think it went off the market, but there used to be this vibration tool that they were using for Cellulite. I don't know if you guys know about that. It was sold as a package of 6 or package of 12. And they're telling everybody to do this stuff, and it wasn't effective. Actually, they got it off the market. The things that actually work for Cellulite is going in there and actually breaking up that bond. So interestingly enough, actually, Cellulite actually is something else you could do with Subcision. Works very well, but you still need to do it with probably some sort of volume, because there's usually some sort of component there with volume loss, and you got to solve that. And a lot of times, one of the best things in that area is Sculptra. Sculptra works incredibly well actually for that. You get nice volume. So something to consider actually. Cellulite, breaking it up with Subcision. So people are kind of saying to do devices, energy devices, things like that. I've had people that were sold packages of, again, like Morpheus 8 radiofrequency microneedling for their cellulite, and it's like, again, really highly unethical, terrible things that they did, actually, that they told them that this is going to solve their cellulite, and it never would have do that. Can acne scars go fully away? So good question, really good question. So my patient earlier today, I had worked on her just one time, and I worked on her about 6 months ago or so, and I did a few different steps for her. She is South Korean, and many of her more superficial boxcar scars especially, are just gone. Like they're just like pretty much gone. Some of the ones like in the middle of the face, there's still a bit of there, but like pretty much like gone. After 6 months, some of those ones, it's like, yes, there's a little bit of redness. If you look at it under a slide, maybe you'd be able to still see that there's still some indentation, still some scarring. But looking at it under really harsh lighting, it's still really, really great. And it's awesome. And she gets to keep that. That's really awesome. Eric Sotomayor is saying, hi, Dr. Qazi, is an online consultation as effective as in-person consultation? We could go through things really effectively online. Most of my patients come from out of state, and it's something I'll go through and walk you through. If there's something that I'm a little bit unsure about, I'll say, we will decide if we need to excise that particular scar. But there's other scars that we're going to excise. I could tell pretty clearly, that's the case. Sometimes I do want to see the depth a little bit better based on some of the images or so, but it doesn't really change too much with management or anything else at that point, though. I'm already game planned that, and I'll just make a decision at that point. But the vast majority of things we're going to go through, I'll circle the areas that we have scars. I'll showcase how I'm going to treat those scars, whether it's with Subcision or volume or TCA Cross or with laser. And we could do all that. In some ways, it may be more comfortable for you because there's, obviously you're just at home, and I could just be able to circle the scars for you, and you could kind of keep that if you want. You could just sort of keep that area that I'm going to be looking at and working on when you come in. Let's see here. Clown is saying, has technology advanced in the last few years to help deep pitted scars? It's really about the way we're doing the same. It's really similar, I should say, the same technology, but the way we're doing it. What I mean by that is that we've always had lasers. We've always had the ability to do subcision, acid. Those tools were around for a while. But the combination of different treatments, I think, has really taken off over the last several years. And we really do have a better understanding of how to manage darker skin types. It was really told, especially during my time, that you can't treat acne scars effectively in darker skin types. It was like told over and over and over again that you can't treat it. I mean, to this day, I think that was really the case. Really, a lot of people were saying that. I think that now it's been blown up. Nobody really thinks that anymore. Nobody really believes that anymore. But we still have a lot of people that will tell patients that nothing's going to work for these scars. You just sort of have to live with it. And they may have been in a city that's not around here. A lot of times it's more like some southwestern state or so, and someone's told that way. But fortunately, they found me on here, and we're able to help them. And that's why I do this. Really, it's like I want to be able to have people that. We're told over and over that there's no hope. I want to have people that we're told that this is what you need to do for your scars. Here's a series of microneedling, that you have to do for your deep, thick scars. And they watched my video and they said, I don't know if that really makes sense. I watched a guy on here and he said that he does so much scars and he never does it that way. So like maybe I should figure this out a little bit differently. And hopefully that is what you guys realize, and you realize that this helps actually. So maybe that's the way to do it. Maybe that's the best way to do it. Let's see here where we're at with things. Birdbash is saying, what's the difference between Fraxel laser and CO2 laser? What is the recovery of both procedures if you want to have less fine lines under your eyes? And do you offer both treatments? Yes, we do. Well, the difference between, Fraxel could be a form of CO2 laser. Usually with CO2 laser under the eyes, you're going to make sure that you do it with, really what you want to do is you want to make sure that you're doing fractionated or low heat, low energy, even for patients that are lighter skin types, because it could scar a bit more in that area. So if you are going to do ablative, you're going to go kind of lower energy in that area. And a lot of times, actually, I prefer erbium laser in the under eye area for fine lines and wrinkles. If you got a little bit more laxity, you have a little bit more of tissue that we need to contract, and yeah, the CO2 laser could be an idea. But usually we try not to do too aggressive around the eyes. It's an area that just could take a lot longer to heal. Area that where if you do run into problems, it's difficult now to help with the pigmentation, for example. So that's kind of my general game plan with this. I usually don't even prefer either a version of the Fraxel or a CO2 laser for the under eye area. A lot of times it's actually erbium laser works incredibly well for that. Can red light therapy help with acne scars? I don't think it's going to help enough for acne scars. It's likely, going to help for other issues, potentially just making the skin a little bit tighter, a little bit more firm if it does anything like that. But it's not really going to help so much with that. Mrs. Jones is saying, I'm so glad I found you, Dr. Qazi. Now I just have to save my coins. Appreciate you, Mrs. Jones. And I'll take it really seriously when you come in. Let me know it's you, by the way. I'll appreciate you. Cassie is saying, hi, Dr. Qazi. My skin is recovering well from the erbium. Awesome, Cassie. Good to hear that. I'm really, really happy. I'll be happy to help you out there at some point for the next steps. But I'm really glad to hear that, actually. And really, part of what I do is that recovery process is so critical. And it's, really interesting because a lot of people in this world were claiming that you had to have thousands of dollars worth of skincare. And I don't do any of that stuff. Like Cassie will know, and other people that are on here right now that are my patients, they'll know that I don't do any of those type of things. I don't have this skincare line. I don't insist on having excessive amount of skincare because actually burns, to treat burns, and I did a lot with burns before I went into acne scars. The treat burns, it's actually a lot of it is very, very basic. You really want to make sure that you get really good microcirculation over there, and you really want to help with that, and as much as you can with that wound healing. So sometimes it involves a specialized burn mask. Sometimes we use this collagen mask as well, and a lot of times also even diet, for example, like zinc could help as well. Omega-3s could help as well. Those little factors actually could play a big role in helping you heal. And then, just regular sunblock, physical sunblock is usually, I think, critical for that first 7 days to 10 days, and then some moisturizers, and then use some antimicrobial creams. So all those things are actually the ways that I use to help you recover, and none of that involves an expensive skincare line. And it's interesting because there's a lot of people that will say, well, I just was sold a bunch of stuff on this. And it's you didn't need to, you don't need to do it that way. We could do it even in darker skin types without these expensive skincare lines. And it just goes to show that it's about the basics, about the pathophysiology of a burn, of the wound recovery. That's the stuff that we have to pay attention to. And obviously we expect patients to also send photos to us every day so we can make sure it's really safe that whole time. And they do, patients send it to us for about 2 weeks, really. And anybody who says that they, don't do that, that's on them, because it's we tell them and we message them over and over every day to send us a photo because we're going to double check to see if it's safe for you all the time. And we want that for you. You want that for us, yourself too, right? So, of course. Let's see here. Lolo saying, is there anything I could do to prevent a ice pick or crater scar, like an over-the-counter scar treatment? Are you saying that you have a pimple and then you want to prevent it? One of the easiest things to do is silicone tape. Put silicone tape on there. That could potentially help with that. Yaya is saying, hi, Dr. Q. What are your thoughts on estradiol on the face? It's awesome. It's really, really good. Sometimes it could exacerbate melasma for some patients, though. So I'm not sure for melasma patients, but it could be excellent, though, for fine lines, wrinkles, skin tightening. A really, really good option. Depending on your age group, it's a really, really good idea, actually, to consider that. What can help with dark spots on the... Oh, I missed a question. There's a lot of questions there, actually. I lost that spot there. Oh, where was it? What can help with the dark spots? They're not acne, but they're on the back of my thighs. So that may need the Pico laser. That works really well. You could try Eucerin's anti-pigment cream, see if that'll help. But that's actually, really consider doing the Pico laser. It works very, very well. What are my thoughts on phenol peel? So yeah, that's why I have an early morning case tomorrow, so I'm not going to be on for too long tonight. But I'm going to be doing a phenol tomorrow on a patient who's flying in for it, and she's the exact candidate for it. She has thick scars, and really we need to resurface that. She's tried multiple different treatments before, multiple times, and it's going to be really, really effective for her. We're going to do a medium depth phenol peel the first day. The next day is actually one of the more, in some ways it's more valuable sometimes, which is the dermabrasion part. I'm going to physically smooth down the scar walls that she has, and she has very thick scars, so I'm going to physically smooth it down with dermabrasion. It's really a surgical procedure, and it's not to be confused with microdermabrasion. This is really properly, like, you really use sandpaper and different tools to smooth it down, and then we will apply some more phenol at that time. But yeah, I do that for the right patient. It really has to be the right patient. And it's like, depends. Sometimes we'll have patients that ask and they're either too dark of skin type or their scars are just too minimal for me to recommend it. It's not worth that like 3 to 6 month recovery. Asian skin types can have 6 months to a year of recovery. So it's like, it really does take a while. Em is saying, how long does it take to see a difference when having acne scars with acne treatments? So it depends. We're rolling scars. It's relatively faster. You can maybe see it about 6 months where you start seeing it lifted up, especially if you're placing a little bit of volume in there. But it's still, there's a collagen response that's occurring with subcision. That takes several months. 6 months is when it starts really. You start to see a difference like a year and a half later. When I did my scar treatments, I noticed it about a year and a half later, really. It took that long. I was pretty happy with it within that first year though. Like I was like, oh, it's pretty good. And then like people started noticing more and more. I'm thinking to myself that actually it does look pretty good right now. And I was like less bothered by like overhead lighting in like the mall, which still, by the way, is terrible. I still think it's great within there, but like elevator lighting was like a little bit less noticeable to me now too, which is awesome. That's really cool that it's like less noticeable and less visible that way. But it was a lot slower than people would expect, and I mostly had like boxcar scars and some rolling scars, and it still was like, visible and at a certain distance, especially with certain forms of light. And now it's way less noticeable. So it's a slower process than you may expect, but it's like over time it gets better and better like that. Those are the worst lights. Yes, they are. It should just be banned. We should be banning certain forms of light. Let's see here. I have really bad acne scars. I'm 4 months into a 7th month Accutane treatment. What should I do? Well, if your acne is under control, oil is better control, let's talk. We can talk and see what's going on. I just don't want active acne, a lot of oil production, but yeah, we could do that. Let's see here. What about TCA, Subcision, and laser for ice pick scars? Those are good options if it's like basically if there's a high concentration of ice pick scars, meaning like you look at the density of it, there's like they're tightly compact and they're very, very deep there, then yes, you may want to do some subcision there. TCA Cross is a good idea. You could do excision as well. You physically take out the scars. And then if there's some thickness around the edges of the scar, then a laser could be really helpful for you. And then a lot of times with ice pick scars, there are little bits of fat that are destroyed. So you may need that as well. Danny Boring is saying, do you do V-beam for redness? I have XLV, and I love XLV because it's got really good contact cooling, and so I could use it safely in darker skin types. I've even done it on Fitzpatrick 6 patients safely. So V-beam, it's a good product, but it's a little bit riskier in darker skin types. There's more bruising involved. They apparently are coming up with a newer device, I think this year or next year or so, is what I was heard, but I'm not sure if it's still coming up soon, but maybe apparently that device has better cooling or so. Anonymous is saying, how long do results take for a combination treatment acne scar session? Maybe a year and a half, depending on your scars, a year and a half to 2 years, potentially. Stay True saying, how long after Accutane being finished can I use XLV? Well, you could do it even while on Accutane. It's just sometimes we just use low heat and low energy, but you could still do it at that point, actually. How do I feel with PIE redness scars? Or how do I deal with that? Makes more sense. How do I deal with PIE redness scars? So easiest thing to start with is just 10% azelaic acid, just over the counter. Start doing that every night. See if that'll help you over the course of a week. Over a course of a month or two. And if it's still kind of stubborn, then you may have to escalate to either stronger creams, stronger forms of azelaic acid, or potentially something like the XLV or V-beam, like someone was mentioning. Jamisi saying, someone told me the Hollywood laser facial, something like that, helps with scarring. Is that true? Well, anything with the name facial is probably not going to help too much with that, to be honest with you. So, and yeah, the Hollywood laser peel, I would never say helps with scarring. It helps a little bit with pigmentation though. It'll help with that. Can scars be treated and can we have glass skin? I like that question. That's a really good question. And it's important because it's kind of something that I hear a lot, and a lot of people will say, "Well, can we get glass skin again? I really want to get glass skin." And it's important, really, just to change your perspective. No longer think of it like you're trying to shoot for glass skin. I mean, it's just something that you're not going to be able to achieve. Is it that is there some possible for you to get smoother skin and for it to be less visible? Yes, but if you're coming into this and trying to get glass skin, when you have acne scars, you're just never going to be happy. You're just somebody who's never going to be satisfied in life, and you just don't even go down this route. Like, just don't do it. It's not worth it for you. Sure, there are some people based on a lot of different factors who get pretty close to it sometimes, yes. But they went into this knowing that they wouldn't really get that. They just thought, well, I just want to see how much improvement we could get, and it'll be really satisfying for themselves. They find it like, okay, this is gonna be really satisfying for me to do, and if I get smoother and smoother and smoother and better than where it's at. But when you try to shoot for like this perfection of glass skin, it's just a lot of times not attainable. And even regular skin without scarring, it's not attainable. It's I say just like try to shift your whole perspective. You suffer from acne, you then suffer from scars, and what we're trying to achieve is make it so that you no longer have to suffer from those. And that's involves so that they were a lot of different things, but a lot of it involves where I just want it so it's less visible and less noticeable to yourself and to other people. That doesn't mean glass skin. If it means glass skin to you, like I said, really this is just not the route to go down. It's never going to be the case. You're never going to really find that full satisfaction with it. And I know that what happens a lot of times is that people have all sorts of external stressors in their life. They have other factors that are causing anxiety, causing stress, and they seem to think that this is something they could control. Potentially, they could get something better with something that's causing anxiety, and they think that, okay, well, if I could control this, everything else will sort of feel a little bit better. But if you're looking at this like, well, I'm going to try to achieve, like, because I want to control something, and the way I'm going to control this is to get glass skin, you're never going to be satisfied with that. Instead, really try to solve some other problem in your life, because maybe there's something else that's more achievable. Maybe there's something else that you could kind of solve in that way. This is not going to go down, be that. I'll tell you that. Manuel is saying, hi, my name is Manuel. I'm a BJJ competitor. I got some acne scars and want to improve them. If I do some procedures to improve my skin, is it safe to train again, or do I have to stop training forever? No, I mean, I do martial arts all the time. I do this stuff. So I have no problem with any of that. It's not like a contraindication just for probably like the first couple weeks though. I definitely want you to be really careful with your skin to prevent friction. So things like that, I would definitely want you to be really, really careful with that. But feel free to do anything you want to do. Like be careful. Like you spend some money if you do some filler on your face, like on your chin or something like that. Like don't do it. Like don't get punched in the chin like the first couple of weeks or so. But beyond that, like I think it's like there's no real issue. There's no contraindication. Like feel free to do anything you want to do with it. Actually, there's no issue for that at all. Let's see here. Any TCA Cross recommendations in Miami? Really, there's very, very few people in the world that would trust a TCA Cross. For myself, really too. And there's like maybe a couple people, out there, but like there's very, very few people. I see the way they do a lot of times. It's just like there's not many people. And like I'm saying this because I want TCA Cross in my own face, and like I was just like I don't know if I really trust people with that. Let's see here. Hi, Dr. Qazi, what's the best face wash for acne skin? Well, that's a trick question because sometimes you don't need a face wash. You could actually just do it with water. You don't actually need like significant face washes or like things that are going to be overly exfoliating for the skin. Just use a gentle cleanser, actually. It's not really about face wash for acne prone skin, but use like a topical retinoid. So do that. That's where you should actually be putting it. Putting your energy in and spending some money on like with a topical retinoid. What about acne scars? Acne scars, really, they're not as complex as people may think. It's usually those are boxcar scars, and you usually have to do a combination of a little bit of volume and a little bit of laser around the edges there. And it takes a few times, really, but acne scars actually aren't as complex as people may expect. It's just the one challenge, though, is that people sleep on their back. And so there's still a bit of friction and I don't love friction after while we're healing scars. So that's the one challenge. So a lot of times I'll have you use silicone tape there. You could have a partner put some of that back on your back, and then we could heal a lot better then. Chest is actually even a little bit easier because there's less chance of that friction sometimes for people. Do you treat tech neck? Yeah, absolutely. Tech neck is like something that you definitely could do, but you could do it actually with Radiesse. Dilute Radiesse works really well for that. Let's see here. Someone is saying that they think that they will be able to achieve glass skin in the future. I mean, yeah, just like wait for that. I think if that's your goal to shoot for glass skin, then wait for that. I don't know if it's ever going to happen. I'm not sure, but it's not really something that I'm going to be shooting for or tell you that that's achievable. I think you just have to change your whole perspective. If you're somebody who suffered from acne and or any scars or any trauma, and one day everything was going well for your life. Actually, one of my patients, he was just like, everything was going fine, and then during my pregnancy, I had severe cystic acne, and I couldn't really control it properly. Of course, she couldn't go do Accutane, she couldn't do lasers, couldn't do other things, and then she had severe cystic acne, which led to bad scarring. Everything was great up until that moment in her life. And now she just wants to be able to get some improvement from that. That's the kind of patient that we're going to try to improve. We're going to be able to get her an amazing, beautiful result for her skin. But I'm not going to be able to achieve glass skin for that. I'm not shooting for glass skin. She's not shooting for glass skin. We're never going to shoot for glass skin. What we're trying to do is try to get us to that, we go back to the before. We go back to what she should have been. She was robbed of how she should have progressed and how she should have gotten a little bit older. And it's pretty traumatizing because, here she was pregnant, and think about this, like all the different issues that occur during pregnancy. And on top of it, you have terrible cystic acne that scars. So it's, very difficult for a lot of people. There's a lot of stories like that. A lot of people that have that. There'll be people over and over and over again that will tell me that they couldn't have access to dermatologists, or they did have access to dermatologists, and the dermatologist didn't touch or examine their skin and didn't put them on the right regimen or told them not to do certain things like Accutane, for example, things like that. And they ended up with really severe scarring. So all that could end up happening, and, we're trying to get back to what you should have been. That's the whole point of this. And if you're kind of on a different pathway, and if you're looking for like this glass skin world, if you're looking for like this world, like this, you want just completely smooth. I don't know if you really truly suffered from acne and from scars, really, honestly, because to me, it's like most people that really truly suffer from those things just want to get improvement from it. They're not shooting for like this glass skin type of look. So it's like kind of, something just to pay attention to. Like I want you to find someone that could do that. Maybe there's somebody out there, I don't know, that could achieve that. I'm not sure. But it's definitely not going to be able to be achieved with the things that we could currently do. And, I'm trying to make sure that we balance results with safety. So it's like I'm never going to sacrifice my patient safety for results. So it's like I'm going to make sure that we're staying exactly safe at all times. And that means that sometimes we may have to hold ourselves back, especially because most of my patients are darker skin type. And I'm not going to go and push really dangerous peels, like phenol peels, on patients with very mild scarring. And I know people that do that. They push it on people like that. I'm not going to do that. And go to them. Go see how it is and see what happens. I've had a patient that did it one time. He was an Asian patient with pretty mild scarring, and he had a redness for more than a year. And it's like, was it worth it? He still found that he was not really satisfied. He still found he had a lot of pores, still had some texture, things like that. So I don't know, was it really like worth that redness for that long? I'm not sure. Stay True is saying, how do I go about using tretinoin while doing acne scar treatments? Well, with us, we don't necessarily use tretinoin. So I'm not sure if you're one of my patients or not, but usually I use a certain pigmentation cream to prep the skin. It has a bit of retinol in there. So if that's the case, then that's what we'll use instead of tretinoin. I missed a bunch of questions, but I saw the last question here. What do you think of Ultra Clear for scars? I'm on the fence about it. I'm open to it. For certain things, I have asked some doctors about it. They've said that it wasn't something that they were particularly wowed by just yet, but maybe also the protocol has for them it has to change, or there's other aspects that have to be involved with it, and maybe you have to do a combination of different things. So it's really not about the particular energy device ever. So it's a tool that you may be able to use, but I think you could also achieve that with potentially like really small bits with like the erbium laser or from like the CO2 laser, and focus energy. So whether or not there's enough of an improvement to justify it, I'm not entirely sure just yet. It's something I'll keep an eye on and see if there's anything changes. But right now, not so sure if there's much of a difference really with any particular energy device. Really, I love using a CO2 laser with a surgical handpiece, which is not going to be solved with something like Ultra Clear. I smooth down the edges of the scar really effectively with an ablative form of CO2 laser. That works incredibly well for me. So it's like, but I can use any CO2 laser for that has a surgical handpiece. It doesn't matter to me what the brand is. It really doesn't. I'm open to all of them. You put me in a different place and it has a different CO2 laser. If it has the ability for me to go really small, little tiny bits, so I could work on the edges really carefully, I'll love it. I'll be happy with that. So that's what I'll do. So stay true saying, tretinoin for anti-aging effects. Can I use it after finishing acne scar treatments or during? Yeah, you'll do that afterwards. And that pigmentation cream will help with anti-aging purposes anyways, but you do it really about 3 to 6 months afterwards, and that's perfectly fine. All right, guys, I have a really cool Phenol peel case tomorrow. I don't think that she lets us share, but I'll double check. If she does, we'll try to film a little bit during that process, but we'll follow up with you again tomorrow night.